All right, I'm going to officially start. So welcome again, everybody. We are going to talk today. I'm going to use somebody, I need a volunteer, to be my client. There will be some assumptions on that, but I'm going to walk you through my appointment, how I present different plans, bronze, silver, and gold, how I introduce layering in there to protect them from the medical debt. Or as I've told many of you, I call it cake. I'm going to build a tiered cake. So I'm just going to show you that. Now, this is via Zoom, so it's a little bit harder. Most of my appointments are in person. Some of you have seen me do this before, so it'll just help re-encourage or reinforce how to do that. Give you some ideas of how you can put that into your practice. If you are not offering ancillaries, you should be. The max out of pocket next year can be up to $10,600. Some of the nonprofits have not jumped on that. I am seeing group stuff though that's jumping on that. The bronze plan is going to be at $10,600. If you sell group insurance and you're not layering protection, you're hurting a whole lot of people. I always quote layers for small business owners, even if they don't ask. Even if they're like, nah, we're just interested in health insurance. I'm like, yeah, but you need to offer this. You don't have to pay for it. So layering should just be part of your commentation about health insurance all the time. My newest thing, when somebody asks me, what do you do for a living? Or what do you do? You know what I say? I'm a health insurance agent. No, I don't say that because nobody cares. Like, oh, all right. Like, instead I say, I protect my clients from medical debt. And they just go, oh, well, that's interesting. I've never heard that. And how do you do that? So, what is it you really do? And use AI to help you figure that out, because it's not just about giving them Anthem. That really is the minimal amount of what we do. If you work with early retirees, which we work with a lot, somebody says, what do you do? I'm like, I help people retire early and not worry about their health insurance. Oh, really? How does that work? Like, it's a whole different way of thinking. If you work with the 26-year-olds that are coming off mom and dad's plan. So what do you do for a living? I help 26-year-olds welcome to the world of adulting. And then they're just going to go, what? You work with entrepreneurs. What do you do? I help entrepreneurs protect their family from medical debt while they get to do the business they love. So figure out a different way of saying that, and that will kind of help you not just be an agent, right? What are you doing? When you layer protections, you're protecting your clients. You're not a salesman. You're not a saleswoman. You're not a used car salesman. I know that's like the worst thing we can be compared to in our entire life, right? It's a used car salesman. You're not a used car salesman, a new car salesman. They're not necessarily trying to layer protections to protect you, right? They might be, I buy the extended warranty, but all the other stuff they're adding, is it really to protect you, right? This is protecting them. If you're not offering layers, you're not protecting them. So I am going to walk you through and kind of show you how that happens. All right, we got 95 in now. All right, I will keep trying to add people. So I need a volunteer. Somebody's going to be online and talk to me, because it can't just be me talking to myself. I need somebody to talk back to me. So who wants to be my client? You don't have to do much. Just give me. All right. You'll have to turn your camera on though.
My camera's on. I don't know who you're picking. You have 90
It
people.
could be you. All right. So I'm going to ask you questions. Don't make this a weird, tricky one. Just your average, that's the one you get 90% of the time. Don't worry about trying to trick me up on that kind of stuff. I am going to not use Health Sherpa, because I'm going to show you it through Allstate, because it's a little bit easier to show you how to layer when you've got Allstate. So you don't have to use Allstate, though. You're going to go, ooh, this is pretty easy. I like this. So I'm going to use Allstate, but you can do this on Health Sherpa, find the quote, and then go to the alternative options you like, whether it's United Healthcare or Manhattan or Philadelphia or XYZ insurance company. But for the sake of ease today, I'm going to show you on Allstate, because Allstate is now letting us quote marketplace insurance and then layer. So, all right. Where'd you go, Virginia?
I'm here.
Oh, there you are.
Well, I'm in the left
You
on my
like moved, I
screen.
think as I'm adding people, your box moved. I'm like, wait, you're over here. So, all right, I'm gonna change the way we view. So be speaker. All right, so Virginia,
Mhm.
I'm gonna share my screen just as I would with the client. I like my clients seeing what I'm looking at. I hate talking over the phone and trying to explain insurance. All right. So I'm going to use my zip code only because to try and do your
Yeah.
zip code, I don't know those companies as well. We are going to assume now we're going to make some assumptions that Virginia has already filled out her intake form. So I already have, if she's got medications, I already have her network. You're going to have to do that on your own. I'm not going to do that for you. So there are some assumptions that Virginia has already filled out all that information. And we're going to do a start date of November 1st. I wish I could show you January, but as you know, we can't see those yet. And I picked a Wisconsin because that's just the place that I know. I picked a birth date of a 53-year-old, kind of figured in the middle of kind of the average. And
Yep.
we're going to assume you're single. And I'm just going to show you. So on the indemnity plan on Allstate, when you first get it, this is what it looks like. When you log on, you're going to do the effective date of whatever you're doing. 2025 53081 06 05 1972 female. And I'm not adding the dependents here, though you can in other spots on when you're doing like health Sherpa, basically. First thing it's going to ask is the tobacco question. So, Virginia, how can I
Never.
help you today?
Um, I would like to make sure that I don't have any medical debt.
Do your clients say that when they come in?
No, they never do. They
What do
say,
they say?
I need some help with health insurance.
Okay, so need some help. So have you recently lost coverage?
Yes, my husband's on Medicare and I'm losing his plan.
All right, so got to get you coverage. According to the paperwork you sent me, we need it for November 1st, correct?
That's correct.
All right. Is there anything you're concerned about? Anything on your health insurance that you liked or didn't like or
I just want to be able to keep my doctors and, if we can have a low deductible, maybe.
okay, important. Do you know what your deductible is right now?
I think it's $3,000 or $4,000,
Okay, and do you know what your max out of pocket is?
maybe 8,000.
All right. I will tell you, a lot of people don't know their max out of pocket, which is a good
Yeah.
thing. That means you didn't reach it. So, yay, you never reached your max out of pocket. So, yes, all right. So, we want to keep your doctors. It's important. Kind of a low deductible if possible. And other than that, fairly healthy. We're just got to get you coverage. All right. So, have you ever used tobacco?
No,
All right.
never.
So mark that. So, I always have consent, just so you guys know, on my intake form is consent. They don't even get to talk to me unless they have given me consent. I don't wait until I'm enrolling them. So the reason I'm not asking, so yep, I have consent. You are a household size of 2, but 1 is going on Medicare. And according to what I see here, you've got your job, his Medicare, and pension. So the total for both of you was 65,000. Sound about right?
Yes.
All right. And we're going to start this on November 1st. And just so you know, I don't know why it says the 15th. That's not a thing. So now this is how it looks on Allstate. You have to give it a second. It's syncing to Health Sherpa. And there it is. It will pull all of the plan options. The default is to show it by carrier. That's just so it'll be all United, then My Common Ground, then Anthem or Prevea. So when you log on your first time, that is the default. I have requested that they default it more like what Sherpa is, which is easy pricing. Easy pricing starts at the cheapest and goes down. So just so every agent knows, there's lots of filters. You can change it to whatever it is. And they are also trying to make it default to you so that when you log in and you change your filters, it just keeps it. I don't know if that will happen. So it's just a little side note for agents if you decide to go this route. I do want to point up here case anybody missed it, discounts available on qualifying supplemental plans when you buy on the exchange. There are discounts and bonuses. So Allstate must have had to pay a stupid amount of money to Health Sherpa to sync this. So they are throwing money at agents. So just let you know.
These are discounts for the actual clients?
For the clients.
So in other words,
not on the marketplace, right? But all the supplemental stuff.
Oh, okay.
So if you go by the marketplace insurance through Sherpa, you sign somebody up through Sherpa and then come back here to Allstate and sign them up for supplemental, they don't get the discount. But if
Oh,
you
wow.
do the Health Sherpa sign up, add the supplements on Sherpa, they'll get discounts. So side note for agents, and if you don't have an Allstate contract, let me know. I will send you a link. So it's this is the time to practice while you're not slammed. Okay, back to Virginia, my prospect. All right, so Virginia, I'm going to show you some options: bronze, silver, gold. Traditionally, a gold plan means it's better, right? Bronze plan is typically considered the lowest, maybe lowest costing, but more out of pocket, and silver is somewhere in the middle. And your plan telling me you had a $35 deductible and an $8,000 out of pocket would be traditionally, that would be in the silver area for group plans. So I'll show you what that looks like as an individual. But there is a lot of holes. So I'm going to layer you a cake. I'm going to show you a 12-tier cake. You know, you pick it. You tell me, oh, I love all these layers, or, oh, I don't need that layer. Okay. If you want to have a 1-tier cake of just health insurance, that's fine. But I'm going to layer them all up and show you, and then you tell me at the end what makes sense to you. Sound good?
Yeah.
All right. So you told me you wanted to keep your doctor. There's a lot of options here. I'm going to scroll through them all because you don't need to know all 82 of them. I know the options really well, so I'm going to pick the ones that make the most sense, the ones that I know based on the information you gave me. So give me a second. I'm going to scroll through all of this. Quartz. Nobody does quartz. I'm going to sort this a little. I have to slide it. There's a gold, best max out of pocket. And I only look at extended bronze. Oh, it's showing weird on here. All right, that's fine. And silver. All right, so I'm going to show you, I've got some plans side by side with each other. This is a bronze plan. So as you can see, it's the least expensive. This is a gold plan, has one of the lowest deductibles. And here is the bronze standard. It's probably our #1 plan. Actually, let me grab this one, silver plan. Nope, it only lets me do 3. So, and if these don't make sense, I can show you others. So this is the absolute cheapest plan. This is United Healthcare. It's not the most expensive, but as you can see, it's a little bit more. Now, I don't know if you noticed, it's only $312. And you probably think, doesn't health insurance cost more than that? Right? I knew you're probably paying this close to work. It is. So the reason I was asking about your income is the government, back when they passed the Affordable Care Act, said it should cost you about 10% of your income. So they will add as much as they need to make the silver plan cost about 10% of your plan, your insurance. So they're giving you a tax credit. You pick the plan you want. The tax credit stays the same. It's kind of replacing your employer plan. That's how it is. You know, instead of you having to pay the full price, they're going to pay a part of it. It's based on your income. So you told me 65,000, great. If you file your taxes at 65, the government's like, great, perfect. You owe the right, you paid 312 and we paid the right amount. But if you end up paying, when you file at 60,000, they're going to go, oh, you should have paid less. You should have only been paying around 300 and we should have paid more. So they'll give you that 12 bucks back. But the reverse is also true. If you said 65 and you make 70, they're going to go, we were paying 50 bucks a month too much. Just pay us that back. There's no fee. There's no penalty. It's based on what you said is income. Now we're only doing this for 2 months, so worst case scenario, you have to pay 2 months worth, but 65, you kind of have a fixed income, so I think you'll probably be pretty good. Does that kind of make sense?
Yes.
Okay. So these are the different plans. As we walk across, you're going to see plan type. Here's the copay for primary care doctor, deductibles, out of pocket for our drugs. So all different kinds of things. The main one I want to show you is copays, right? This one's a $50 copay for your primary, not your annual. Your annual is free. This one, it's a $30 copay, and this one's 50. The deductible, 1,500 versus 0. Primary care diagnostics, 50% after deductible. Here's your primary care visits again. Specialist, this one's 100, this is 60, and this one's 100 too.
And does the deductible include the copay?
So no, it does not. The deductible only applies when it says something like this. When you pay a copay, that's all you're paying. You're paying your $100. The rest of the visit is free. The insurance is paying that. It's applying towards your max out of pocket. So good question. This one, there's a specialty RX, so you'd have to reach the deductible first for those specialty meds, but you don't have any specialty meds. Everything you had was generic. So now it says 25. Just to let you know, it doesn't mean it will cost you 25. If it's a $5 generic, it's going to cost you $5. But the insurance is not going to kick in until it costs you at least $25. Does that kind of make sense?
Yes.
So if it's a
No, sorry,
$40,
say that again.
so if it's
So,
a $40 generic prescription, you would pay 25, the insurance would pay the rest. But if it's a $5 generic, you're only paying $5.
okay,
You don't have to pay 25.
got
It's
it.
not that they're just saying we're not, the insurance is saying we're not going to help you pay for your prescriptions until it costs more than 25 bucks or 15.
Okay.
Same with emergency. Emergency is $25. Oops, sorry, 50% or 25% co-insurance. So you got to pay the deductible first.
So spend
Outpatient service,
$1,000 first and then I pay 50%?
correct. Up to the max out of pocket, which is 7,500. Or no, it's not on here. We'll get to that part. I'm still new with the Allstate quoting. Outpatient services, they don't have it listed right now, but typically chiropractic is the same cost as a primary care doctor. So if it's $60 for primary, chiropractor is 60. It might mean cash is cheaper. Sometimes chiropractors only charge you $40, so you can talk to your chiropractor. But outpatient surgeries, outpatient physical therapy, things like that would all apply towards outpatient services. Those are almost always going to have deductible first, then co-insurance.
And are they planning on populating these areas?
Yeah, I'm not sure what's going on with this. It usually is filled out, just so you know.
Okay,
Mental health, same thing. It's all covered. Typically, counselors are covered under a copay, but if you actually had to go inpatient, it's the same as any going into a hospital. And then pre and postnatal care. I don't know if you're expecting any children, but they do
hold
have
on.
that, and it's covered pretty well. So we can do one of these. I know you said that out of pocket, or the deductible was important to you. Now the difference between these two, $560.16 versus $312.31 is $247 a month. Now, if you were doing that for a whole year, that's over almost $3,000 that you're paying just in case you need it.
I don't even go to the doctor.
Right. So I don't know if that makes sense, but I understand if you do have to, right? I don't know if you've got, $7,500 laying around if you ended up in the emergency room. So that's where I'm going to show you some layers. So this is our base. You have to have health insurance. Here's our base cake. But based on this, let's just for right now, keep that 560 in your head, but let's go with this one. It covers your doctors. It's a decent plan. The co-pays for these two different companies is the same. So we're just going to stick with United Healthcare. Is that all right for right now? We can always
Yes.
change it.
No
So I'm
worries.
going to add that to the cart. Now, ER is a big thing, right? 7,500. Hospital is a big thing, 7,500. So accident, still the number one reason people end up in the ER. So I'm going to layer it with an accident policy. And give me a second. This is the max out of pocket benefit. So this line right here, your max out of pocket.
Wait, sorry, can you show me where it says the max out of pocket again? Did we miss that?
It doesn't show it on here, and I'm not sure why. So we'd
Okay.
have to look at the plan details.
Okay, but you know what it is. So that's where you find it though, right?
Right. Yeah, it's
Okay.
9,600.
Oh,
But
geez.
next year, this is the thing I want you to know. It's 9,200 this year. It's jumping to potentially 10,600 next year. So it's a huge, I don't know about you, I don't have 10,000 laying around in the bank just in case I end up in the hospital. So that's why I want to layer this. So the accident policy is still the number one reason people end up in ERs. It's still one of the more expensive things. Even just, I swear, you walk in, you breathe the air of the ER, and your bill's 4,000, right? And you have to pay 100% of it. So this is an accident policy. It's very affordable, as you can see the costs over here. Let's assume worst case scenario, next year you end up in the ER because you slipped and fell and your bill is 10,600. So if we got you an $11,500 accident policy, well, that's going to pay the whole bill. And it's $38.50 a month. We can adjust this to anything you want, but if we start there, or at least 10,000, I mean, maybe 6,000 is not such a big deal to pay. The difference is $4.50 a month. But I want to protect you.
Yeah, that sounds good.
Yeah, so I'm going to just do that because unfortunately the max out of pockets just keep going up and we've got a couple years before you're on Medicare. There's a couple of riders we can add. The one that I like the most though is sickness and hospital. The bad thing about an accident is it only covers an accident. If you end up in the hospital because you have a gallbladder that's about to burst, the accident policy is not going to help you. But if we add this, $68.85, if you end up in the hospital for anything that's not accident related, it's going to cover you and it's going to pay that.
So for anything that's not related,
Correct. It doesn't have to be accident. If you're in the hospital because of a sickness, not just accident, this will pay it as well.
So a kidney stone, that kind of thing?
Yep. As long as it's a hospital admission. So let's add that.
Okay.
So remember, the gold plan was costing you over 500. We're not even there yet. Unfortunately, critical cancer, heart attack, stroke. I don't know if you have cancer in your family, but I know you've known somebody that's had cancer.
Yep.
Everybody has. I think you'd have to live in a bucket somewhere to not know somebody who's had cancer. We can add a cancer policy. This amount right here is if you were diagnosed with cancer, they're giving you a lump sum, $25,000, it's yours. Obviously, you can use it to pay medical bills. You can also use it to go somewhere else. It's your cash. I know of a gentleman who actually had a $50,000 cancer policy. He was diagnosed with end-stage cancer, and he took his grandkids to Disney World. He wanted them to have one really awesome memory. And that's what he used his money for. So it's your money to do what you want. I recommend the 25 because, oh, heaven forbid, you get diagnosed at the end of the year and you reach that max out of pocket and you're still being treated at the beginning of next year. You've now reached your max out of pocket for 2 years in less than a month. So 25 is kind of my minimum because then you're 10,000 and 10,000, you're covered. Plus there's some extra. So, and it's guaranteed issue. We can certainly do more if you want. I don't know how prevalent it is.
Are the 50,000 and 75 are not guaranteed issue?
Correct. So there would be some simple underwriting questions to ask. Have you had cancer? Are you, going through treatment? Are you in end stage renal failure?
Okay.
Have you had heart stuff? But if you've had any of that, we have guaranteed issue, or we can do underwriting.
So it's also heart and stroke?
Yep.
Okay.
Now, if you get skin cancer, let's say some basal cells, and they scrape that, they're not going to give you 25,000, but they are going to give you some. There's a little bit, even for some of those non-invasive cancers, you'll get a little bit.
Okay, let's do the 25,000.
Okay, I'm going to add that to cart. And dental. Do you need dental insurance? I'm assuming.
I do need dental. Yeah.
All right. Dental is I love dental. Keep my teeth, right? There's a couple different kinds. The indemnity plan pays you a dollar amount. It's a little less expensive. And then this is more your traditional plan, where like what you have right now, you would pay a copay. Um, they're going to clean your cleanings will be free. They're going to pay a percentage. This one is the more expensive because it has a $3,000 annual benefit.
Oh,
Now, if you
do they
know,
cover implants and root canals, things like that?
I do not know. Let's look. I'm going to download the brochure and we will look at it. Come on, maybe. There it is.
No big deal.
But let's look at the brochure. So here's what Allstate says. There's your basics, right? Everyday dental, basics and preventative, every plan, kids. 0 to 64. Now you can keep it after you turn 65, but you have to sign up before you're 64 years old. And we can add vision. All right, so here's the details. Preventative, it's a $50 copay. No wait. Cooks in right away. Basic services, $50 per procedure. So that's a filling. That's your basics.
Okay.
Major services tier 1, you pay $50 and it's covered. Major services 2, it's $250, and you can have up to $3,000. So they're paying $3,000. So it's not a max out of pocket. It's not like once you pay $3,000, they pay it all. $3,000 is the most they're going to pay in 1 year.
Okay.
Traditionally,
it says crown. It doesn't say implants, but crown. Okay.
yep.
Just
So this one is crowns, fixed prostate, prostates. Yeah, fixed prostate is at your dentist. Yeah, that word.
Orthodontics.
Partial denture, fixed partial dental retainers. Tier 1 is general. If you really don't like getting surgery and you need some of that general anesthesia, oral surgery, composite fillings, and periodontics, which periodontics is where they do deep cleaning down below the gum line. So they're listing that as a major service 1. And then we can add vision. Here's the eye exam. You just pay either $15. Do you get glasses every year or every other year? Kind of is really how it helps. This one will have discounts on UV protection and anti-scratch versus these ones that are just covered. So level 2 will cost you a little bit more.
Okay.
And there's some of the exclusions. Teeth bleaching. Need your teeth whitened. They're not going to cover it. That's considered cosmetic. Now that's the copay plan. You can, I'm going to close this.
So if I just am someone who, if I just go to get cleanings, twice a year.
I probably wouldn't do that one because if you're doing good teeth, has your dentist told you we see some crowns in the future or no?
Yeah.
Well, then I would definitely take one of these value plans. There's a plus and there's a value, as you can see. There's not a whole lot of difference. This one will not cover majors at all. So if
I don't want that.
they're not going to cover, this one will cover you 15% up to $1,000. And for $38, your cleanings are pretty much going to be free. So
okay, let's do that one.
All right, we're going to add that. Would you like to add vision? As you can see, the simple one,
sure, let's do
$10. Go get your eyes checked for $15. I don't know how anybody cannot have. It's cheaper to get vision insurance than to pay cash. And term life. Do you have life insurance?
Term life. Where do you even see that?
Right here on the side, there's term life, and then there's term life with critical illness. The negative thing of life insurance is you have to wait till you die before you can get any of it. Term life with critical illness means that, we'll just use this 25 as an example. If you live a long, healthy life and you die of a car accident, right? Somebody's going to get 25,000. But if you're diagnosed with a critical illness, a variety of them, Alzheimer's, heart valve surgery, coronary cancer, heart attack, they will give you some of this money for your treatment. So you can subtract the 25, let's just say 10,000. So the benefit's still 15, but you actually get to access some of that money. So I really like that.
I did. You do like that on top of the other stuff?
Right, because this one's going to help bury you, but it can also help with treatment. And you don't have to access this since you already have the 25. Or we can do a term life without that. As you can see, 25,000 is $18.40. But that 25 is for somebody else, which is fine for $18.40. Or as you can see, 150 for $90. So
are these medically underwritten? I mean, do I have to go through that?
very light ones that we answer questions. So
Okay.
this one is not going to have somebody knock on your door and come out.
Okay. I'll do the term life
Okay.
regular one.
All right. 20, 25,
25
25.
sounds good.
All right. There you go. So now we have your United Healthcare plan. We have the accident, cancer, heart attack, and stroke with that hospitalization, dental and vision, and life insurance for $523.35.
That's pretty good.
It's
That
cheaper than the
actually,
gold plan,
yeah, I like it.
and it's going to cover you better because we also threw in dental, vision,
I
life
just have to
insurance.
say, this is brilliant that they did this.
It is.
I mean, it's so everything you needed. I just had to, show 5 screens to try to get somebody.
Correct. So
Do you have to change so you're not using Health Sherpa at all?
So I will tell you, we're not going to, obviously. So now we'll go back to, so now you guys have just in general, you've kind of seen how I do this. I haven't looked at the questions. I don't know if
Oh, yeah,
my
good.
office has been helping.
Sorry, one question
So,
on the term. What's the term? 10 years, 20 years?
cannot remember on the top of my head. I think it's 10. It's either 10 or 15, but it is guaranteed after that. And it's also opens the door, just so you know, even offering this opens the door to life insurance questions. So by offering it, somebody's going to go, hey, that might be like, well, you know what? I own a business. Or, okay, so maybe this isn't the best life insurance for you. Or, you know what? Let's get this really cheap one and done. And then let's schedule an appointment for another life insurance question so that we can actually deep dive. But for right now, it's only $15, right? So you can add this and then talk to them. I think I blocked it from downloading. There we go. All right. This is a great way to just bring up the question of life insurance.
Okay. And
So
then can you show, I guess, can you download like summary of benefits and everything right from their
yep,
website? Like you could never, if you decide to use this, you could basically never use Health Sherpa again.
correct.
Oh,
Now,
wow.
when you do this, I'll let everybody know when we do this, we hit apply. It will take you to Health Sherpa. So you do have to have a Health Sherpa account. And at the end of the year, you're going to be on Sherpa. You're going to see all this stuff. So it's connected. So
Okay.
it's, but you don't have to enroll people through Sherpa if you use this. But if you hit apply, you're going to go to Health Sherpa. You're going to have to do the syncing and all of that. And then it will bring you back and you finish the applications for everything else.
Okay.
Instead of, like you said, here's multiple screens. And then
Yeah, I mean, I
there
just
were
think
times I had 4 carriers up and I'd go, Chris, George. I
right,
mean, to try and not have them time out before I was done. So this
right.
is brilliant. And I'm not kidding when I'm telling you Allstate wants your business. They are going to bonus. Oh my goodness. I was getting just a snippet. Chaz was telling me the bonuses are huge because they want you to do this because they had to pay a lot of money to Health Sherpa. And as far as I know, they're the only ones doing this.
What
So
are the discounts in these products? Do we know? Does it, I mean,
I don't have those.
okay.
Um, there we go. I'm going to stop share. Chaz, who's my guy,
Yeah.
Allstate, they're doing some training. Anybody who signs up for Allstate can say, hey, talk to me. I need some training because they really want to do this. So I don't know what all of those things are necessarily, but there is a discount. And if you're a math guy, Josh George, I could see him putting in a Health Sherpa, and a marketplace plan and putting accident, blah, 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 and then going and seeing it without, and then you can see what those discounts are. So I'm not saying they're majors. They're not giving them like 50% off, but they are giving them a pretty good discount. And they're bonusing you and you are doing what's right for your client.
It's so much easier to sell that way, to show them everything at once instead of piecing it together and then writing out it,
Correct.
much
Now,
better.
I do still use this. I mean, you can print this off and you can send that to, I have showed, and if you don't like Allstate, I don't know, maybe you hate Allstate because you love United Healthcare. Okay, United Healthcare is another one that has lots of these all in one place. So you could pull up your Sherpa and then pull up United Healthcare. If you love Manhattan, and many of you know Philadelphia American Life Gap Insurance is honestly one of my favorite ones. You can still do those things, But if you want it for ease and getting through open enrollment, I don't know if you can go faster than this. But I do have a document that I will show you that it's I use it for layering, showing them the dollar amount. I know I think one of my people in the office created their own. Like it, do something that shows them while you're talking to them what it's going to cost. So I'm going to share really quick. I've shared this document. I speak a good English. I've shared this document before. I've emailed it out to many people. So this is what it looks like. It's for your records, where I list the name of the carrier, all United Healthcare, if they have a gap insurance, which would be like that hospital, the accident, critical illness. Are they signing it that they don't want critical illness? Dental, hearing, it could be a combo. Short-term disability, which, by the way, if somebody says they're self-employed, you should be asking them if they need disability insurance. A lot of them
Do
think
you
they
mind
can't.
sharing this again? I
Yep.
know I have it, but other people may not.
Yes. Short-term stay is another great one. People that are in their 60s, they may ask about long-term care. You can go, hey, do you have a short-term care plan? Aetna has one. GTL has one. I think GTL, though, I think you have to be over 65. Medicare or Manhattan.
Heartland, Bankers Fidelity.
Yeah, there's plenty of short-term care ones out there. And then life insurance. I think these are things you should be offering. You should be talking to people. Allstate makes it easy. And then you can still say, okay, I see we've got your health pretty well covered. Do you have plans for when you get sick and need to stay home? You can ask that because you're already showing them the benefits of all these layers. So this form, you can use that. And then at the end, it totals it. So I would still use this, even with my Allstate option. I would still use this. So I hope that kind of makes sense. I'm going to look at quotes in a second. But or not quotes, comments. Anybody can have this document. I am happy to share. Why reinvent the wheel? You can have it. So I want you to just start practicing and see. I just showed her the tiered cake and compared it to that gold.
Yeah.
Allstate has some guaranteed issues. So does United Healthcare. United Healthcare has a guaranteed critical illness policy if you write their accident. So on their accident, you can add a guaranteed critical illness. Guaranteed doesn't mean they're covering current cancer. Okay, just nobody's going to cover current medical stuff except the marketplace. But if somebody has skin cancer and then 2 years later has liver cancer, it's going to pay. And they got a cancer policy. So anybody who walks into your office, if there's two of them, a husband and wife, and one of them is sick and you're not offering this, you are failing that second person because they already know the cost of a critical illness. And if it happens to the other spouse, they will take it. I don't think I've ever had a spouse of a sick person not take a critical illness policy that I've offered. And now you have some critical illness that you can offer guaranteed, even on Allstate. Now, it's not going to help their current. And you can say, I wish I could help your current situation. This isn't going to help your current situation. But if something comes back, we're going to assume you're going to, beat this cancer. You don't have to wait 5 years or 10 years to get a critical illness policy. I can get you one right now. Do you believe offering these policies benefits your client if they run into those situations? I believe it. That's why I sell it. I've seen it. When somebody calls me and says, oh, I just got diagnosed with cancer. Is there anything you can do? Oh, I hate that. I hate it. I hate it. I hate it when I didn't tell them about this. Because now it's no. I'd much rather get the calls that I do where somebody said, thank you for giving me this. Or my husband just had a stroke. And I'm like, all right, don't worry. We got the critical illness policy on you. You guys get well, and we're going to reach out and help you file those claims. So that's why I'm doing it every time. Just do it every time. And I don't know if you saw, it was just a natural thing for me to do it. I know it's hard the first time. So practice. Bring in your BFF. Bring in your spouse. Bring in a
That's
teenager.
a good
Does
idea.
this make sense? If your teenager can get it, they're going to go, yeah. Or they're going to tell you, what? That doesn't make any sense, right? They're going to be honest with you. Practice. Just do it. Offer accident every time, dental every time. It's so affordable. So, all right, let me see if I have questions. Would this work for state-based exchanges? Unfortunately, Pat, no. They haven't been able to do that. I do think it's something that they're doing, but instead of one contract with Health Sherpa, they have to have a contract with all of those different state exchanges, but they are working on it. But you can still do layering, do the state exchange, and say, and now I'm going to show you how to cover all of that. So then you have the two tabs up. This is all great, but can only quote combine with marketplace through Allstate for FFM plans. Yep. So they are going to do it, but you can still combo them. There is no reason that you can't layer. You just have to have two tabs. All right, the state. You're showing them, hey, there's an ER copay of 1,500 or 3,000 or deductible. I'm going to show you how to protect you from that. The max out of pocket is 10,000. Hold on to that. Pick your health. Remember that gold price. Now let me show you. And then you start layering. So I just use Sherpa partly for the ease of doing this with one person to show you how I can layer it, but you can still go, here's your health Sherpa or your state exchange plan. All right, now I'm taking you over here and I'm going to start layering it. And that's where that document comes in really handy. Does it allow to show the SOP? It does. Again, practice, gonna get used to it. In fact, the summary of benefits on last year was way more detailed. I actually liked the summary of benefits on Allstate's version versus the Sherpa version. So, like they were showing copays of things you don't even see on the Health Sherpa. So they do have the summary of benefits. All right, let's see. On the accident plan, if I add the hospital rider, do they cover every time the person is admitted to the hospital or does it cap out? It caps out for that year. So that's the benefit for that year and then it resets. So if they have that hospital plan, that accident and a hospital rider, don't cancel it. All right, it got them through this year's deductible. Now it's gonna do it, starts over. So term length, I pulled it up and I know it's on here. It's been a while since I've looked at it. Let me look. Oh, it's 10 years and a 5-year rate guaranteed. So again, this may not be the best life insurance, but is it better to have some life insurance than no life insurance? It's a really easy conversation. One of my friends, Eric Jan, some of you know who he is. He was the #1 life insurance salesperson for North American a few years ago, simply because every quote he did on Allstate, he just added the term life. He just added it. He sent it to them and they signed up for it. The best life insurance is still better than no life insurance. But if you're really into life insurance, this is the conversation starter. Sickness, the hospital sickness rider and the accident will vary based on age. So the older you are, the more expensive it is. The younger you are, the cheaper it is. For what we added was $68 to add that sickness and hospital rider for somebody who's 53. Somebody who's 25 is not so much. If applied on Health Sherpa, is there a discount for life insurance? I don't think there is on the life insurance. It's the accident, it's the supplement, it's the critical illness. Can we handle renewals on this? Sure. Not going to be as easy, but you can, especially when you're talking to somebody. Kristen says a webinar is happening right now with Allstate and Health Sherpa. They're going to be doing lots of them. It's going to be on their YouTube. And heck, Chaz told me if I wanted to bring in 4 people, he would do a one-on-one, with 4 or 5 people. So they want you to know to sell this. So don't worry about, will there be training? There is. So it's a really great option. I will share my form. Somebody said, didn't hear the details on how to sign up for the Allstate program. I will send a link out. So I will send you all a way to just sign up and you're going to get the same as street level. So you can get that contract. My form is fillable. Why is the dental plan with unlimited benefits less expensive than the plan with a 3,000 annual maximum? All right. So the dental plan, and I would certainly go look at the Allstate plans, but those unlimited and stuff, it has to stay in network. And then it's a copay. It shows you exactly how much you will pay for the procedures. And it's pretty cheap. I know somebody that got like 3 crowns. It was crazy. They were paying like $250 for a crown. So that's why there's never it's not really the insurance so much paying out, is the insurance has a really good contract. So they have to be in network. That copay unlimited plan will not work out of network, which we are really sad because none of the dentists in our county takes Allstate, and we like their plans. Virginia is one of those lovely people who wants to read through every page of a 2 or 3 brochure and then decide on adding the product. Okay. And we do have those people. I do think, and I'm okay opening up the brochure. That's why I did it. I'm not necessarily going to remember all of these details. I can tell you right now, though, by November 15th, I'll have all these details memorized. Open it up in front of the client. Like, great question.
Yeah.
Let's pull that up and say, and I'm going to send that to you. And I'm going to send that to you. I want you to have all of this. None of it's a secret. Dig through the details. I had a guy dig through the details of a whole an indemnity policy, and he actually saw something I'd never seen. I was like, all right, sweet, cool.
But
So
no, anything you do through
later.
Allstate, it's still going to show on Health Sherpa.
Correct, because you're actually enrolling on Sherpa.
Yeah.
And you can certainly tell somebody, we can add this later, but you're losing the discount. How about I add it now? I'm going to give you all the brochures, and we can cancel these, and you're not out any money, but at least if you like them, you've got the discount.
So that was my question. Are you just writing the ACA and a couple of the things while she reviews her others and comes back to you later and you write those as a standalone, or are you putting it all together? And
I put it all together. There is those few. I mean, there's absolutely those few that are like, you know, okay, doesn't bother me.
Mm-hmm.
All right. But then I would probably say, let's reschedule. Let's follow up before December 15th. Because I want you to read these. I want you to be comfortable with what you're enrolling, but I don't want you to lose the discount.
But some of those are not standalones because they were riders to the accident policy, correct?
The hospital one, the sickness hospital is a rider, and same with vision.
Right.
So you wouldn't want to enroll them in dental and then have them come back and say, I want vision. I mean, you can do it, but it's going to be a pain. So I would just say, let's just hold off. I'm going to print everything off. I'm going to send you home, email you, whatever, the documents. All right, let me look at my calendar. What's a good time? Schedule the appointment right then. And really do make it, as I've said before, selling it isn't the point. If that's your goal, is to sell, they're going to know. If your point is to protect them, my obligation to you, Mr. Client Prospect, is to protect you, to show you your options. What you decide then is on you. If they choose not to, then that's on them. So, and I said SOP when I meant SOB, which is summary of benefits. SOP is standard operating procedures, and I hate that phrase for personal reasons. So it's like, you know, if you can't protect clients, what are you doing? I do this. This is why I still do this, because it's not a job for me anymore. I want to protect my community at large. This is why I train agents, because I want to protect community at large, not just my local county. I want you to protect your local county. I want you to protect your state. I am so busy with just the state of Wisconsin. I have very few business outside of the state. Agents that have contracts and actually service people in 50 states, I don't know how they do it. I'd rather give it to somebody in a different state, especially Florida. Thank you very much.
Understand
No,
why.
Yeah, I have a client who moves to Florida. They don't care. Like they're whatever. They don't have a network. But anybody who lives in Florida, we're like, no, let me give you somebody in Florida. So Brooke says this might vary. Do you see that most accident or hospital indemnity plans normally require at least 24 hours in the hospital to pay out? It's not usually a hour. It has to say admitted. Now, accident doesn't. An accident policy is an accident policy. Admitted, emergency room doesn't matter. But yes, hospital indemnity or like Manhattan's out-of-pocket protection, which is fairly cheap, you have to be admitted. not observation. And I don't care if you're under observation for 3 days, they won't pay. They have to be admitted. So,
And which
Um,
one, are there any new ones by any chance that are allowing observation? No, they don't like that. Okay.
they don't. There's no diagnosis code. That's why it's observation.
Okay.
Aaron wants to know, did Congress expand or renew the subsidies? No, don't plan on it.
Terrible.
Honestly, if it happens, it's going to be a December 31st Hail Mary, and then great, open enrollment continues through January 30th. Part of me is like, okay with that. I feel bad for the people who are going to get screwed, because there's absolutely people that are going to get screwed, but then it's going to become a permanent fixture. If they just kick it down the road next year, I don't even know that they'll fix it. I think it'll just be another year fighting. But so it could happen. Don't plan on it. Prepare to not do that. Don't expect it. Have I completed an application with Allstate after it syncs with Health Sherpa? I have not, but I have had other people. So I just haven't had anybody new. I don't meet a lot of new people, but I am going to make Josh, John, and Sam, my agents in the office, do it so that we can know if this is working. Last year it was really rough and everybody gave up on it, went, we're not doing this. Allstate heard loud and clear, and they're guaranteeing that it's a smooth transaction, that it's easy to be done. So let's see if there's anything else. All right, I think we're done. We got 5 minutes left. Woo, look at that. Any questions that anybody else has?
Do you know if Allstate has a similar setup like this for the Medicare side? Where you can add these things?
Not like this, because again, then they'd have to connect with every carrier, and there isn't just one enrollment platform for Medicare stuff. I mean,
Health
.gov,
Sherpa has the
Medicare.gov,
Medicare.
but that's a different contracting. Medicare. So,
but
I
Health
have
Sherpa
not.
has Medicare now.
Yeah. Well, they only have some, and not in all states. And
okay, all right.
yeah.
But if
I
you
also
use,
do not know, by the way, I don't know if it connects by off exchange. So that's the other one. I'm not, so Health Sherpa is going to have 2 tabs. They're going to have an on exchange and off exchange. I'm not 100% positive if they're going to show off exchange. So that's another question I have for Chaz. And are they going to be able to differentiate it or not? So if you know somebody needs 100% cost, they're not getting a tax credit. Sometimes off exchange is cheaper.
hey, Chris, I have a quick question.
Yes.
This is Jackie. Sorry, I don't have my camera on.
Jackie.
Hey, so if we move over to the Allstate Health Sherpa, does our data from our regular Health Sherpa transfer, or do we have to start all over?
No, it's connecting to your Sherpa. You have
Oh.
to have a Sherpa account.
Oh, okay. I thought it was going to open up a whole new one and I was going to have to start over with all my client data.
No,
nice.
if you hit apply, it takes you to Health Sherpa to log in. So
Okay.
it's not a separate one, which is
thank
why
you.
anything you do on this will show up on your Sherpa as well.
Oh, that's awesome.
Yeah. Yes, Jill.
Thanks, Chris. I was just curious. I just shot off an email to Lisa, but I was just wondering, is there any way you would want to, we've got 70 people on here, would you want to just do everybody like jump on and do a training with Chaz, or is that like too much of your time?
Well, I
Right.
can do that. But I don't even know who's contracted, who's not. So that's why he told me if I had a bunch of people who said they wanted to do it, I could schedule it. So, so if anybody wants to, let me know. I'm happy to put everybody in and get it done. I might just make one. And of course I will end up, recording it. So I am planning on that, but yes, if everybody wants to, I will make an appointment. I don't know, October something. But I know everybody's busy because now we're into open enrollment.
Right.
So my email is aca-academy@outlook.com. Please email me anytime. I'm happy to help. I will be putting this on YouTube as soon as I can. So again, my email is aca-academy@outlook.com. And yes, I am. Somebody asked if I am contracted with Philadelphia. I love Philadelphia American Life. I can send you that contract as well. That is one of my favorite. I love the gap policy. That's a different type of one. I like it because it doesn't care if it's accident or hospital, or you have a splinter in your foot, it doesn't matter. But it's only available in some states. So, and it's, I can't tell you, some states have it and some don't. And next training is going to be the last Thursday, the fourth Thursday in October, which is October 23rd. So that will be my last live training. And again, look up my YouTube channel. There was a webinar every week in 24. There was a webinar in every week in 2023. So there is lots of new things. I use a surety for my short-term disability for the lower income, Mutual of Omaha for the larger income. So if somebody is only making $26,000 as an entrepreneur that they need replaced, a surety is the best. They got a really cheap rate. They're easy to quote and they kick in quicker. You can have it a 7-day wait. Mutual of Omaha, it's a 30-day wait. That is the soonest that they will do. But if somebody is owns a health insurance agency and can, you're getting commissions and you have that, you can actually make it wait 3 months before it kicks in, and they will take higher income. So I use a surety for the lower, and I don't mean like they don't have to be dirt poor, but Josh, do you know what the max is off the top of your head for a surety short-term disability? You're on mute.
What do you mean the max?
Like the max income level.
Oh, for the surety disability? Ooh.
Yeah.
I unfortunately haven't had one of those clients yet.
I can't remember. I know I've done it. It might be 100.
I know I've ran the quote at 100, and it worked, but I didn't really go any higher than that.
So you can do that. So a surety, Mutual of Omaha, I'm not sure who else does. I know there's other out there, but a surety, I like it because it kicks in right away. And somebody who's only making 30,000 can't necessarily go 30 days before it kicks in. And it's a very affordable, easy underwriting to get in. So anybody else? I will not be doing training in November, December, or January. I just cannot. It just can't. So my YouTube is the ACA Academy, but if you look ACA Academy up, you will not find me because there's something American Christian Academy that is a big ginormous country thing all over the country. So look up Coach Chris with a K. That's much easier if you don't already have my YouTube channel. Look up Coach Chris. It's much easier to find that way because I'm clearly not the exercise guru. So, but yes, Coach Chris as opposed to ACA Academy, because you won't find it. I will put the link if you want to click on it right now. I put it in the chat, so you could just click it and hit follow. If you hit follow, whenever I add new things, it'll be there. For those who missed, Brandon and I had 7 live courses that we did throughout the month of September. In January, those will be open to the public. So if you're on my thing, you'll get a notice. Also, you'll be able to see some of those. But people paid to see that, so we are not opening it to the public until January. It's still available. It was only 179, something like that, to get 7 live courses, and 3 of them have been 2 hours long. So they did not stick with the hour. So if anybody still wants them, they're available. We still have 2 more live classes where we will be deep diving into the alternative plans. Anybody who purchases those courses also gets access to all the other ones. As always, I appreciate you jumping in. I'm honored that you spent an hour with me on September, and we will talk to you next month. Happy open enrollment, everyone.
Thanks, you too.
Thank you, Chris.
Thanks, Chris.
You're welcome. Thanks, guys.